My name is Blessing Egede. I'm from University of Texas, Rio Grande Valley. I'm doing a presentation for case study number 7 about Ashley, who was a 17-year-old girl that was referred for reevaluation for having for diagnosis of autism since she was 17 years old. During this presentation, I will be addressing a brief description of the case, giving a correct diagnosis for case study number 7, rationales for my diagnosis and evidence and treatment plan. Before I start, I want to give a brief description of autism spectrum disorder. Just say a little features that are associated with the diagnosis. Most individuals with autism spectrum disorder also have intellectual disability, impairment, and language impairment, like slow to talk, slow to grasp language comprehension, and so forth, as you can see here. Even those with average or high intelligence have uneven profile of abilities, and most of them have motor deficits. They are seen with odd behaviors like banging their head, biting their wrist, cutting themselves, and so forth and so on. And the adolescents and adults with autism spectrum disorder are prone to anxiety and depression. There's just so much about this ailment that we can talk about, but I just wanted to focus on Ashley this evening and run quickly about this presentation. You can see from my presentation that Ashley is not independent with ADLs as her case was presented. She was only able to read and spell at second grade level, and she has very decreased understanding of materials. She do have language disability. And, I just gave you some of the clinical manifestations that is seen in autism patients. For Ashley, she manifested some of it. For instance, when her schedule is slightly changed, she gets so very irritable and begin to inflict self-injurious behavior on herself. She gets very aggressive and very upset at others. The history of disease, we can say that autism spectrum disorder is a progressive disease with speech delay diagnosis, like I have said earlier. Ashley was first diagnosed when she was 3 years old, and she lived with it. She was actually diagnosed with Klinefelter syndrome, which is always associated with autism at 3 years old. And she had some, with that, as she continues to grow, she had obesity, static encephalopathy, some facial dysmorphic features with no genetic testing contribution. Her family histories were dyslexia, epilepsy, Asperger's, and Asperger's. Some of the testing that Ashley had, were non-verbal IQ of 39 and verbal IQ of 23, which was very low. She had a full scale IQ of 31, adaptive score of 42, average is a score of 100. Ashley has strong memory skill, irrespective of all of this. So with Ashley's clinical manifestations and the things that she displayed behaviorally, I came up with a diagnosis of autism spectrum disorder, severe intellectual disorder, with language impairment, maybe associated with Kleefstra syndrome, although there is no genetic connection to that. Autism spectrum disorder is a neurodevelopmental disorder characterized, by speech and verbal impairment, social impairment, repetitive and or restrictive behavior. Like I have said, those are the things that, are seen with individuals with that disorder. Statistics says that the disease is common across all ethnic and racial background. No difference, the disease has no respect for social economic status and is more common in male gender. The causes are unknown, but often associated with environmental factor, abnormal brain formation, genetic or hereditary. Like we have said, the disease, if you read about Ashley's case study, you will see that the disease is characterized by severe intellectual disability, dysmorphic facial features, hypotonia, and severe speech delay, like the one Ashley has. And sometimes it's associated with multiple comorbidities, DSM-5 diagnostic criteria. Currently, autism spectrum disorder is behaviorally diagnosed based on criteria defined by the American Psychiatric Association in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5. Some of the signs and symptoms we see are progressive and undeniable deficit in social communication and social interaction across multiple contexts. Patients have inadequate repetitive pattern of behavior. So if you disrupt what they are used to, it can make them very upset, like Ashley acted. Like one of the behaviors mentioned about Ashley in case study number 7. They have some of the symptoms must be present in the early developmental period, but may not be fully manifested until social demand exceeds limited capacity, or may be masked by learned strategy in later life. Symptoms cause clinically significant impairment in social occupation or important areas of life. Now, some of the diagnostic tools that can be used to, diagnose children for autism are autism diagnosis interview, revised ADIR, a clinical diagnostic instrument for assessing autism in children and adults, autism diagnostic observation schedule, children autism rating scale, and Gillian autism rating scale by Haysford Rafiuk. Treatment for autism. Although autism is uncurable, it does not have a cure, but there are treatments that can be put in place for the patients to be manageable, for behavior training and otherwise. An ongoing routine care by a multidisciplinary team specializing in the care of children or adults with intellectual disability is very necessary and recommended. Referral to age-appropriate early childhood intervention program is recommended. Special education program or vocational training for adults are recommended. And I wanted to say that, autism disease affects people on different levels. There are some people who will tell you they have autism that are genius in class, and there are some people who, are really, really sick with the disease. So some autism patients can actually can have good educational standard, can have good educational know-how, like no disability with their abilities for education. There are surveillance for monitoring, and for monitoring their behavior. And there are comorbidities that comes with autism, disease for people who have a severe disease. Some of the comorbidities are vision loss, hearing loss, cardiac problem, renal urologic problems. And evidence-based strategies set apart for treatments are behavioral interventions, cognitive behavioral intervention packages, comprehension behavioral treatment for young children, language training, modeling, naturalistic teaching strategies, teaching packaging. Autistic children can go through intensive communication strategy to promote communication and aid in the communication with people, with other people. Also, intensive interaction can aid in the communication with people who have limited verbal capacity due to profound and multiple intellectual ability. Use of social studies, scripting, and video modeling can be used to help individuals with autism understand how behavior works in real situations. And I hope that I have been able to send a, a good message about autism, and these are my references, just in case you want to learn more about autism spectrum disorder associated with either intellectual disabilities and other disabilities. Thank you.